Hi there, my name is Jonathan Carp. I'm a practicing dermatologist in Southern California. I just watched Dr. Joseph Mercola's video, How to Cure Toenail Fungus, and wanted to post a video response pointing out some inconsistencies in his video, as well as just in general to provide further information to you if you happen to be looking on the internet for information on toenail fungus or onychomycosis. The first thing is, what is toenail fungus? Well, it's simply an infection of the nail, but it's a complicated infection in the sense that it can infect the nail plate, which is the surface of the nail bed, which is under the nail. It can even affect the nail matrix, which is basically extending past the matrix into the finger. This is the reason why it's so difficult to treat toenail fungus, because it's very difficult to get medicines that penetrate to all these levels if they are infected. Dr. Mercola reports that a fungal infection is a type of a yeast infection. This is not true. Now, a yeast is a type of a fungus. It's a subcategory of a type of fungus, but a fungus is not a type of yeast. Now, this sounds like semantics, but it really isn't. And the reason it isn't is because if you have been diagnosed as having a yeast infection of your toenails, it's actually treated in a completely different way. This is a good point to bring up the fact that there are actually 5 different types of onychomycosis or toenail fungus, and each one of these may be associated with a different treatment and or a different kind of internal problem that you might have. For example, certain subtypes are found more commonly in diabetics, certain subtypes are found more commonly in patients with HIV disease. So these things are not semantics. So really the first thing that you need to deal with is whether or not you have a fungal infection in the first place. Now, the reason I mention this is because I see 3 to 5 patients on average per month who have been sent to me with a diagnosis of onychomycosis, or they've been self-referred because they feel as though they have onychomycosis, and in fact they don't. They actually have another nail condition that mimics toenail fungus. Now, there are many conditions that can actually mimic toenail fungus, and I'm not going to go into it right now, but the most common causes are psoriasis and lichen planus. Now, let's move on to oral treatment. Because the nail infection that we're dealing with here can penetrate to all of these levels, as I discussed, oral treatment appears to be the most effective. Dr. Mercola reports that it's many thousands of dollars. It is not many thousands of dollars. I just looked on drugstore.com just to get general prices, and it appears to be somewhere between $750 and $850. Now, this is still quite costly, there's no question about it. And to further complicate things, a lot of insurance companies do not consider this something that they cover because it's considered by a lot of medical insurance companies to be cosmetic. If you have an underlying medical condition such as HIV, or you have some kind of suppression of your immune system, or you have diabetes, then oftentimes you can get your insurance plan to cover this treatment. In diabetics especially those who have leg edema and dry skin of the lower legs, often this dry skin is actually a type of a fungal infection, and it's very important to get this treated, especially if you're a diabetic. The reason is because active fungal infections that you may think are just kind of dry skin can actually cause breaks in the skin. These breaks in the skin can then lead to secondary infections, and especially in patients who have diabetes, it's very important, and it's part of your proper foot care for you to make sure that any kinds of skin infections fungal infections, make sure these don't lead to bacterial infections because of the cracks that these infections cause. Now, the oral treatments, Lamisil and Sporanox, work reasonably well. We reviewed the price, but I'd like to make one important point, and that is that after treatment, it takes a long time to see results because you need to wait for the nail to completely grow out. In addition, after treatment, it's very common to get a recurrence. So how do you prevent recurrence once you've been treated? Well, it's very important that you do something. I recommend that patients use an antifungal powder in their shoes, such as Zeazorb AF powder, or you can buy an over-the-counter antifungal cream like Lotrimin cream or Lamisil cream and use it on your feet a couple times a week, the entire foot that is, to make sure that you don't get any kind of recurrence of the fungal infection. Likewise, if you actually have a family history of fungal infections in the family or toenail infections, then you can use these types of treatments such as antifungal Zeazorb AF powder in the shoes, or topical Lotrimin or topical Lamisil on your feet once or twice a week to prevent the infection. There are many causes of fungal infections. As Dr. Mercola rightly suggested, occlusive footwear, having your feet sweat a lot, using say your athletic shoes to walk around all day in, these types of things definitely increase the risk of getting a fungal infection. In addition, there are genetic factors that have been determined. There are familial patterns that we see in fungal infections. So if you happen to have some of these predisposing factors, then it's important that you do something to prevent it from happening. Topical treatments for fungal infections are very, very difficult. The reason is if you happen to have an infection that's very superficial, well, maybe you'll get a fairly good response. But if those infections are thick, or your nail's already gotten thicker, or it's penetrated into the nail bed, or it's penetrated into that area down into the finger, it's very difficult to get a topical preparation that will actually penetrate deep down in there. As Dr. Mercola rightly suggested, oftentimes if you can thin the nail out, you can increase the response rate. One of the things that I've seen work recently is using a topical urea compound. A urea compound will actually dissolve part of the nail. You can discuss this with your doctor, and you can combine that topical urea preparation with an antifungal medication like Lamisil or cyclopirox. Cyclopirox is a very potent antifungal, and the people who make cyclopirox actually have a lacquer called Penlac, which is basically like a nail polish that their studies show actually penetrates to a reasonably high depth, reasonably good depth for treatment. So that's another alternative, but in general it needs to be combined with preventative measures and a full discussion basically with your doctor regarding different kinds of treatments. So basically I hope that provides a bit of an overview about what nail fungus is, how it's treated, where it comes from. For further information on the internet, you could probably go to the American Academy of Dermatology's website at www.aad.org. Have a nice day.